Me if there's a problem. Now recording. So I am recording. So the main thing about exotics, and I know a lot of people have an interest in exotics, and I can only stress that you will get advanced training if you are hired in a practice that does enough exotics. Because, like I said in lecture, some of your veterinarians will see a rabbit or a bird or a guinea pig here and there. They're not necessarily an exotic specialist. Um, so, not every person's going to have access. I have worked for some doctors that absolutely refuse. They will not see rabbits. They will not see ferrets. Birds are a whole nother ball game. I don't know if you guys have done birds yet, but they are very high stress, and you have to be very cautious. So not everybody's going to anesthetize a bird. But again, like I've learned a lot just having Nemer in the office because, like I said, I don't have a lot of experience. I mean, I know the principles, but I had a friend that she did all her exotics because she liked exotics, and I personally don't. So I was like, go for it. Um, but let me talk about, I'm just going to have the study guide. I'm going to talk about some brief questions, which one was basically like the physical exam is challenging because a lot of these species are not normally out and handled and aren't used to being transported. So what my goal is, if I was to go in the room with like a rabbit, a ferret. Now, some people are like, here's my rabbit, like hold it. It loves to be held. And some are in the cage, very scared. But I try to do so much of my assessment from verbal information from the owner and observation. You can look at their hair coat, you can look at their eyes, you can look at their nasal cavity, you can look at their mouth. I look for any drooling, nasal discharge, soiled. The perineum is the area around the rectum, but the perineum is the area between the rectum and either the vulva or the penis. So that area, if it's excessively matted or soiled, could that be a problem? And I try, if it's possible, they can bring the animal in its cage, because you can look at the cage, you can look at the urine, the feces, you can look at if it's filthy and the animal has an upper respiratory, well, maybe it's because they have the urine fumes, and maybe the bedding is the wrong bedding. The water is gross. You see what I'm trying to get at? There's a lot of information you can get from observation. It's the same with a pig. You're not, when you grab that animal to get them out, you need to have everything ready to go. And so what we try to do in exotics is get a lot of our information from observation. And then when the doctor's ready, we only get them out one time. So the doctor can do a physical and we can give them their drugs. So, and the moral of the story is have as much ready to go. And so that's what I did with birds, because once you start handling them and they're stressed, you don't have a lot of time to kind of be farting around. It's like, I have all the drugs laid out. I have everything set up. So once we grab that bird, nobody's like looking for the drug and let's draw it up. And meanwhile, the bird's freaking out. And then, so again, the other issue with exotics is lifespan. A 3-year-old rat is like equivalent maybe to like a 9-year-old Great Dane. So how old does this species get? And, you think they're young on paper. If they don't have a very big lifespan, that's a challenge. Now, I know, has Nemer talked about some anesthesia and exotics? I think she said she has. Okay, so if you now think about this. We have two options. Sometimes we are sedating them because we need to draw blood, or we need to do a beak trim or a wing trim or a nail trim. So sometimes they're just getting a sedative. They are not completely anesthetized. Or they are going under general anesthesia, but there's different ways to achieve that depending on the species. If I'm a rat or a mouse or a gerbil, you're probably not going to have a catheter. So IV is kind of out the window. What options do we have? Well, they have tiny muscles. So we might have IP, which is peritoneal. And hopefully you guys got on the study guide what side, or I'm sorry, it was on the discussion board. What side do you inject a rat when you go IP? Okay. Because their cecum is on the right. And also, if I have an exotic, like let's pretend head, tail, you're going to tip them and give the injection this way. So the abdominal contents, and I don't aim my needle this way because I'm going towards organs. I would give it this way. And I would put it on the left side, and everything else would be on the right. But the thing with IP, and like Kitty Magic is an IM protocol. It's designed to anesthetize them. When you go IP, it's an anesthesia protocol, but the absorption is variable. So it could take 20, 30, 40 minutes for them to go asleep. It is not a quick induction. And remember, it's a bolus because you cannot titrate. You don't poke the abdomen, wait, poke the abdomen, wait, poke the abdomen. You're going to calculate a full dose. The only time you can titrate a drug is when you're giving it IV. So when you go intravenous, then you can give a little, give a little, give a little. But when you go IM or IP or sub-Q, it's a bolus technique, and you're giving a full dose. And again, it's going to take a while. I talked about handling in a rabbit, and like I said, this isn't a restraint class, but I know Neemer's not a fan of scruffing, but the big thing that I'm talking about is supporting their back end so they don't kick. It happened at Purdue during a research project, and someone just grabbed the rabbit like this, and it kicked the back legs and broke its back. It had to be euthanized. So the bigger they are, I mean, any size rabbit can do it, but if they're big, could be worse. And then I talked about sunken eyes, CRT in rabbits, and any exotics. And let me talk about NPOing because it varies from species to species whether we withhold food and water. They typically are not going to do that. First of all, they can't vomit. So you got the rats and the mice and the rabbits. They're not vomiters. So withholding food isn't a necessity. But also they have a high metabolism and they're going to be prone to low blood sugar. So that animal should have food all night, should have food that morning. Really, it doesn't need to be pulled till maybe 2 hours before. So maybe when the owner brings them, pull the food. And speaking of food, I mentioned this in the video. I always have the owner bring some food because your clinic may carry some rabbit pellets but it might not be something they like. And I like them to bring their water because I said on recovery, do they know how to drink out of a dish? Do they drink out of that little thing that they tap? So how they drink is essential. Now I said, what are routes for fluid therapy in the rabbit? In the rabbit, you can get an IV catheter. They have a tiny little leg. You can get a cephalic in most rabbits. I put a cephalic in a ferret once, and it was a 24 gauge, and it was a short little leg, but it can be done. So you can do IV, you can do sub-Q, you can do IP, and also don't forget IO. Now, in an emergency, obviously IP and sub-Q aren't going to help us. If an animal is crashing, those fluids are useless. You have to either go IV or IO because that's going to get you immediate access. Okay, sub-Q, I was about to say PO, IP aren't going to be beneficial. So be familiar with that. And then the reason to not use atropine, I know you guys have talked about it in exotics, but they have the rabbits have an enzyme called atropinesterase. If you remember enzymes, and I talked about this in anatomy eons ago, erase takes away the effect of something. So a lot of the acetylcholinesterase erases the effects of acetylcholine. Atropinase erases the effects of atropine. So that erase, in my mind, means it takes that away. So it just can be ineffective. It's not, you're not going to damage a rabbit by giving it. It just might not work. Now, if you are having a cardiac arrest, I'm going to take my chances that it might work and you're going to give it. But the other thing we worry about in rabbits is they are hindgut fermenters. We worry about GI motility. And atropine slows down the GI tract. So what I'm telling you is it's not used as a routine pre-med. But if you're going intra-op, you can try glycopyrrolate, or you can try and give the atropine because some clinics do not carry glyco. Erase, Erica, E-R-A-S-E. Let me type it for you here. I think I'm spelling this wrong here. Atropinase. Hang on, my keyboard's being funky. So hopefully, Erica, this makes sense. Yeah, so I'm blanking right now. Atropinase, atropinesterase, but a lot a lot of enzymes in the body have ACE or erase at the end, and my brain tells me they usually break something down, and when they break it down, they take away that effector, they erase. So that's how I remember things, is I love word association. I can associate ACE or erase with taking something away. So the problem is you give a rabbit atropine, they have natural atropinase in their body. It's going to break the atropine down before it can be effective. So again, most rabbits, it's not going to work. If you have an emergency, is it going to kill the rabbit? Well, the rabbit's already in cardiac arrest, so why not? Why don't we give it a try? If you see where I'm going. So sometimes, because it's not every rabbit, it's variable, so you might as well give it a shot. And I will tell you, it said on the study guide, sedatives you can give rabbits, ACE and Valium. ACE promazine is used a lot, and remember, it's better when it's given like ACE buprenorphine or ACE butorphanol or midazolam and butorphanol. Midazolam is not a reliable sedative in dogs and cats. I said, remember, they have to be pretty out of it, but it works fairly well in exotics. So you might, and again, Niemer was the one that said they use intranasal midazolam, which I had never heard of. So I think that's pretty cool that you can drip it in their nasal cavity and it's absorbed. So, and remember, I have a question, why are xylazine doses higher in rabbits than dogs? Any of your drug dosages in mg per kg is going to be higher in exotics. Does anybody know why? Does anybody want to throw it out there? So a mouse has a heart rate of like 300, a horse has a heart rate of like 40. Metabolism. These guys burn through drugs. Okay, that little metabolism is, you know, the littler they are, the higher the metabolism. So if you look at a mg per kg dose, it is going to be higher. That's not a typo. It's going to be higher in a rabbit or a mouse or a rat than it is going to be in a dog or a cat. And remember, if you're going IM or IP, your doses are higher than IV. Why is that? Why would the IM or the IP dose be higher than my IV dose? And someone can verbally say it if they don't want to type it. You are allowed to speak on here. Exactly, Lexi. Slower absorption. When you give something in the peritoneum, some of it's going to get lost in translation. As it gets absorbed, some of that drug is lost. When you're in the vein, all of that drug is available. Okay, it's bioavailability. So this is what you guys have to do with caution is, hang on one second. When you guys give these drugs, and your clinic a lot of times has a protocol sheet, sometimes taped to a wall, sometimes you're going to list a drug and you're going to see IM dose, IV dose. And then every drug will have like an IM dose, a sub-Q dose, an IV dose. You don't want to mix that up. Because again, if you give the IP or IM dose IV, you're more than likely going to overdose your patient. So you just have to be really cautious when you're using these different routes. There's different dosages. And again, you'll get used to very common protocols. Okay, and remember the difference. There was a question, are induction agents given as a bolus or to effect? If it's IP or IM, it's a bolus. If it's IV, it's to effect. Ketamine by itself is never recommended because you have to use very high doses and they'll be like a board. I mean, if you want to like work with a rabbit and just flip them over and work with them, but when you give ketamine, it causes intense muscle rigidity. So ketamine dextromethorphan, ketamine ACE is a common combo for sedation for like radiographs, blood draws, teeth trimming, grooming. Ket-ACE is not going to give you anesthesia. So be familiar with the fact that that's why I talk about drugs being synergistic. They work together. So ACE and butorphanol are good. Ketamine and Valium are good because, yes. Is the dosage the same IP? Michaela, that would determine, or that would be dependent on the animal and the drug. But most often your IP and your IM dosing, your IP is probably going to be a little higher than IM because you're going to have a better blood supply in the muscle than the peritoneum. Does that make sense? Your smallest dose would be IV, then next would be IM, then next would be probably sub-Q IP. Because when you go sub-Q or IP, that drug has to go through more layers to get absorbed. But good question. A rabbit can be blind or visual intubation. They're very challenging. So it kind of depends on the rabbit. The problem is their mouth doesn't open really wide. Their teeth are somewhat narrow. Their tongue is very thick. So looking back there, you definitely need a laryngoscope. If you can't see the larynx, then you may have to just kind of pass. Niemer can probably give you tips. But it can be visual or blind. We usually use uncuffed tubes is what I've always been taught. Niemer's like, we use cuff tubes all the time. So again, some of that is doctor preference. But when I talked in lecture, the Cole tubes, COLE, are the ones that did not have a cuff. The Murphy tubes do have a cuff, but most exotics that I was familiar with use the uncuffed tubes. Oh, the chamber induction, I didn't talk about gas induction. I've been kind of talking about IM, IV, sub-Q, but a lot of clinics will mask induce, or they'll put them in a box, the chamber, which if you only have a big box, you might want to put towels to make the size smaller, because you got to fill that whole thing with anesthetic. So you need to try to make it smaller, or use a little box if you can. And 5 liters oxygen with a box, 3 liters oxygen with a mask, 1 liter of oxygen intubated. That's kind of a general guideline, but you got to fill that box. And again, sometimes they hold their breath. I mean, eventually they're going to breathe. I mean, they have to. So they will breathe. Assessing depth. Again, the thing with exotics, I feel like they're either light or they're super deep. So you gotta have to look at heart rate, respiration. You can try and do blink and jaw tone. Their eyes are difficult sometimes to read. But doing like tickling that little fur inside their ear, sometimes you'll see like a little ear twitch, or pinch the toe and look for the pedal reflex. Be familiar, I talked about normals in the PowerPoints. So I want you to be familiar with anesthetized normals. Now, blood pressure and CO2 and pulse ox are the same in dogs, cats, mice, rats, birds, whatever. Oxygen should be above 95. Systolic should be above 100. Mean should be above 60. CO2 should be below 40. Where it gets different is their heart rate. So the way I judge heart rate, because there is no magic number, is whatever their heart rate is before drugs, if it starts falling to getting to about 50%, so if they had a heart rate of 300, if they're getting to like 170, 160, 150, that's about half of their heart rate. I'm very concerned. So you might either turn them down, may have to give them atropine. So let's see. Oh, about keeping them warm was a question. Minimal shaving, warm fluids. And again, a cheap man's warm fluids. If you don't have an incubator, my practice, again, we used a lot of warm fluids, it's called an incubator, and the fluids are kept in there and they're kept warmed. You can fill a dog bowl with hot water, put the bag of fluids in there, and then give them warm IV fluids. I always, before I put warm fluids into an animal, I always drip them on my wrist like a baby bottle. Okay, so if I'm flushing, I flush it onto me and then I hook it up. So if I've heated up fluids, if they've come out of an incubator, because we had people that turned up the incubator too high, and I went to grab the bag to hook it up to the patient, if not quite burned my hand, but it was extremely hot. And I was like, I tried to run it over my wrist. It was boiling. I'm like, you can't hook this up to this patient. This is way too hot. So whenever in doubt, test it on your skin, run it over your skin. And then assessing pain, I look for hiding and bedding, reluctance to move. Niemer told me a good thing in rats that I need to put in the notes. Bruxism. I don't want to do it, I'll hurt my jaw. When they grind their teeth, so grinding teeth, unkept, like they look ruffled, their ears are down, they're sunken back, okay? Again, these are species that want to start grooming, and they're fastidious. So if they're not grooming, if they're hiding, those are all things to look for. They're not eating, because you want to give them pain. I talked about why do they have a shorter duration? Higher metabolism. So the agent of choice is buprenorphine because it lasts the longest of all the opioids. I've said this now in 3 separate lectures. buprenorphine, that's why we like it in cats, is because it is so long, has the longest, you know. Now, in a cat, it's going to get you 8 to 12 hours. In a rabbit, it might get you 6 to 8 hours because of metabolism. You're still getting a longer time frame than if you were to give like morphine or butorphanol. Now, the other drug I did not put as a homework question is for post-op pain is Metacam, is the NSAID of choice. It's a liquid. It can be given in small doses. It can be mixed with fruit drink flavorings. Like I said, I got excited when we started working with exotics. I came on my shift. There's a bottle of strawberry daiquiri mix in the fridge. And I was like, we're having a party. It's virgin daiquiri mix. Make sure you do that. But you can mix the strawberry daiquiri drink mix with drugs to flavor it. For exotics, I'm sure Neemer's probably brought that up. So that shouldn't be, you know, fruit juices, applesauce, they like stuff like that. But post-op meds, the same. What other questions do you have about exotics that I can answer? Or anything from the study guide or the PowerPoint that did not make sense? And again, I'm just talking about very general exotics. You'll definitely, I mean, the thing that is important, they are in the handout, Michaela. The normals are in the PowerPoint. Did you get that? Oh, well, let me do, hang on. I didn't type out the blood pressure. So BP, this will take me just 1 second. Where's my symbols? There's more coming, hold on. Oh. Oh, I was supposed to be typing to everyone. Oh, hang on. Okay, so those are the basic normals. Oh, and respiration is gonna vary. I wanna say 20 to 30. Like the respiration and the heart rate, the respiration is in your notes. The heart rate is gonna vary. Oh, I keep typing just, hang on. Now, like I said, the heart rate is hard. I can't say there's one heart rate. Um, but like I said, if I have an animal that has a heart rate of 300, I definitely need to treat if it hits 150. But if it starts going 300, 250, 220, 210, 180, what is that telling me? It's dropping. I need to try and bring it up. Now, very important in exotics is they become hypothermic very quickly. Hypothermia causes bradycardia. Also, hypothermia decreases the need of anesthetic. If my animal is dropping, and this is dog, cat, horse, foal, mouse, I don't care what it is. If a temperature is dropping, your anesthetic need goes down. So you should be turning down your ISO. You could be trying to warm them up, but the problem is it's very hard to warm them up during surgery. It's almost impossible. So you may have to give atropine, try to warm them, but in the meantime, you should be decreasing your anesthetic. You shouldn't need as much. So what other questions do you have? Anybody that's still here? Anybody that's awake and still listening to me? I got clocked by Bo in the head, so I'm going to be taking Advil and taking a nap here shortly. He jumped up and hit me, and I got all tingly, eyes watering, everything got grainy. And it's just like shooting, like right here. He just got happy, and I bent down to get AJ out, and Bo jumped and like big boxer head right here. Yes. I'm usually on the lookout because I know he does this and I wasn't looking. And bam. Okay, well, what we'll do probably Monday is I will post the quiz during class time. I don't think we need to have a second review. So it'll like, oh, and your bovine quizzes, I think were good. So I posted the bovine, I got those graded. One feedback on that real quick while I have everybody here. Hang on tight, I know it's Friday. I hope people are still listening to me. There was a question. Guaifenesin was the drug that's titrated. It's the only one, everything else is a bolus technique. Guaifenesin is not an anesthetic, it's a muscle relaxant. They were prone to hypoventilation. Acepromazine is if they're excitable. They're both sternal. A calf uses a stylet. An adult is blind with palpation and sternal. Swine. Well, yeah, hyperthermia, Doppler. Oh, the reasons we don't routinely perform surgery. I did get some answers like it's tough on them, it's stressful. What I was looking for was, first of all, they're a production animal and it's not economical to do a lot of these advanced surgeries. And because they're calm, you can do a lot of stuff with sedation. You often don't need general anesthesia. So that's what I was looking for. Why is there a location site in swine? And it says also, what does withdrawal time mean? The lateral neck muscles, because they're not a prime cut of meat. So a lot of people got that. But the problem is when I said, what's the 15-day withdrawal time? People said, well, that's when the drug is out of the system. And I gave you partial credit because I'm like, why do I care if it's out of the system? Then why don't I list withdrawal times for dogs and cats or rats or mice or horses? To complete the thought, you needed to say so that they can be sent for slaughter or for consumption. Because if you give a cow an injection or anesthesia, that milk often has to be pumped and then dumped because it would have trace drug. So the meat or the milk cannot be consumed. So that was to get the full credit. So if you only got partial credit, it was because you just said that's when the drugs are out of the system. Well, then that would apply to all species and not just these guys. The other thing was 2 common applications. I was looking for bloat and aspiration. Now, if you put myopathy, neuropathy, I accepted that because they are prone to that. If I got eructation is burping. That is good. I want them burping because if they're burping or farting, that means gas is escaping. It's when they're not eructating. It's when they're not farting or passing gas. That's when we worry that they get bloated and gas, but they're constantly producing gas, constantly. So it's got to go somewhere. So now anesthesia slows it down, but the problem is when you lay a cow down and sometimes what will happen is the rumen gets blocked and they can't do one or the other. I said, why is it recommended to have suction? Because they produce copious amounts of saliva, which means a lot. So you want to get that out of the way. It wasn't to clean the mouth because of like debris and things like that. So, and why are swine challenging? Now, I got an answer on some tests. It says they're challenging due to their unique species characteristics. Like what? You see what I'm saying? I don't know if people put that and they were like, I don't know, I'm just going to write that. But you got 0 points if you put that, because that doesn't tell me anything. What is unique about them? They are excitable. They are high stress. They scream. They have thick muscles. They have thick fat. They are resistant to sedatives. They are difficult to intubate. They are prone to hyperthermia. There's 8 things you could have told me. So if you tell me just because they're unique, I need specific reasons they're unique. Again, I always tell you guys, look at your tests, see where you went wrong, and if you want to discuss it with me, please email me, text me. I'd be more than happy to look at your test and explain how I graded it. Okay, so your bovine stuff should be in there. Your test should be in there. I need to look at your exotics, and I will send an email with this video, and the test will go live at class time. We will not review on Monday, and I will keep you posted if I can get you in the building week 8, because I'm going to start sending some emails and say, I need these kids in the building. I got to do some stuff. Okay? What else can I answer for you? You guys are supposed to fill out, you probably got teacher evaluations. I'm supposed to remind you guys to do that too. Now, I'm not influencing your teacher evaluation. You guys are evaluating me. Be honest, I do take feedback. But I will say, I hope the way I've done this class, I've never done it before, and I've just tried to do things in a certain way, and nobody has reached out to me. So I would hate to get like a review and say, she did this really sucky, and I don't hate, you know. I would hope that you feel comfortable enough with me that if you have a concern on my delivery of the course, I'm very open to suggestions. So, but put any feedback, I'm open. Peyton, I did not. Oh, you guys have been very generous with your feedback. I do appreciate the feedback. And I definitely need feedback, good and bad, so I can take it. But it would hurt to get blindsided on a review when nobody has come to me personally. But do what you gotta do. Do what you gotta do. You do you. All right. I'm trying to think of anything else. Okay, if there's no other questions, I'm gonna let you guys go. And you guys have a good weekend, and I will get this converted and sent to you as soon as I can. And no Zoom Monday, just test, quiz, exotics quiz. You guys have a good weekend. Have a good weekend. Have a good week.